Hello, I'm Dr. Sagar Lonial from the Winship Cancer Institute of Emory University in Atlanta, Georgia. And we're going to spend the next few moments talking a little bit about how the safety profile of iberdomide might help and be critical for its future applications. At the International Myeloma Workshop this year, I actually updated a presentation looking at the combination of the new CELMoD iberdomide, previously known as CC220, in combination with either bortezomib, daratumumab, or carfilzomib. And one of the real features of iberdomide that we've also reported on previously that I think really speaks to the combinability of this agent is its very good safety profile. If you look at iberdomide compared to other drugs in a similar class, the IMiDs or immunomodulatory drugs, such as thalidomide, lenalidomide, or pomalidomide, what we do see that occurs with iberdomide is some myelosuppression. We do see some anemia, thrombocytopenia, and more significantly, some neutropenia compared to the other two. But they're not nearly as severe as certainly we see with lenalidomide or pomalidomide in a similar class. When you begin to look at non-hematologic adverse events, there really is not much. Very little incidence of DVT with appropriate prophylaxis, very low incidence of constipation, diarrhea, GI toxicity, or fatigue that is common to many of the IMiD class of drugs. What makes iberdomide as a CELMoD so unique is that while it does more potently bind cereblon, it also does more effectively activate immune function. And so these two things actually are part of the engineering of the molecule, and I think result in a better and more favorable safety profile. What we saw when combined with daratumumab, bortezomib, or carfilzomib was a very high overall response rate. And that overall response rate was not accompanied by a significant increase in adverse events compared to either carfilzomib, or bortezomib versus iberdomide given separately. And this, to me, I think really speaks to the power of iberdomide-based combinations. What we have is the ability to partner with another more potent immune-enhancing event like iberdomide without necessarily increasing the adverse event profile of that combination, something that we often see in other 2, 3, or 4 drug combinations in myeloma. And this, to me, really positions iberdomide not only as a great drug in the salvage setting for relapsed and refractory myeloma, but also as a great partner drug for some of our commonly used agents in myeloma, particularly in earlier lines of therapy or even in the newly diagnosed setting. Thank you.